We're joined now by ABC News medical contributor and emergency physician, Dr. Darien Sutton, who's in L.A. tonight. So, Doctor, first, we should acknowledge there's so much that we don't know about exactly what happened here with Bronny James. But broadly speaking, just explain to us what cardiac arrest looks like and how it differs from a heart attack.
Well, good evening, Lindsay. So cardiac arrest is due to a sudden failure of the heart rhythm, which leads to unconsciousness, loss of a pulse, and loss of breathing. Without accurate and quick intervention, a cardiac arrest can inevitably lead to death. Cardiac arrest often gets confused with the term heart attack, which is a blockage of blood flow. But these are two very different processes. A heart attack can be associated with chest pain, shortness of breath, and if not treated, can lead to a cardiac arrest.
And you're an emergency physician in L.A. where this occurred. How should cardiac arrest be treated when it happens in a setting like a basketball practice? How crucial is that immediate treatment?
Immediate identification and intervention is of utmost importance, as was just stated. Immediate compressions from CPR is the most important technique, and I can't stress this enough. Anyone and everyone can do CPR, and as well as get an AED, an automated external defibrillator. These are those machines that we often see on the walls that line often these athletic facilities. Many people feel nervous to use them, but in the event that you have any level of suspicion, grabbing that AED, turning it on, and it will then speak to you and tell you exactly what to do.
I think that many people think of athletes as young and healthy, robust, but we all saw Buffalo Bills' Damar Hamlin suffer cardiac arrest on the football field last season, and Mola mentioned another USC player needing CPR last year. So how common is this kind of cardiac event for young people? I mean, Bronny, we're talking about just an 18-year-old.
Yeah, well, as an emergency physician, I have the unfortunate experience of treating cardiac arrest often in my clinical career. And I have to say that the majority of the patients that suffer from an acute cardiac arrest are those who are older than the age of 65. Although younger patients do come in with cardiac arrest, it is still rare. Now, the cause is what we're trying to figure out. With older patients, it's often due to something like a heart attack. But with younger patients, we have more questions. Could this be due to an abnormal rhythm? Could there be an underlying genetic disorder that existed before that maybe that patient did not know about? Or could there be external causes, for example, in the discussion of Damar Hamlin and traumatic arrest from sudden force? Or could there be environmental factors, lack of oxygen, exposure to excessive amounts of heat? All of these questions are what goes through the mind of an emergency physician when we're evaluating a patient in acute distress and an acute emergency from a cardiac arrest.
As for Bronny, the statement from the family spokesperson says that he was treated and is stable, no longer in the ICU. What could that mean for just how serious this was and for his potential prognosis going forward, understanding that we may just not have enough information yet?
You're absolutely right. We may not yet ever have information on the specifics of this case, but the fact that he is out of the ICU and at what is a regular medicine floor is a reassuring prognosis for us. What we'll have to do is wait and see for more information to come out. As emergency physicians, when we are stabilizing a patient in acute distress from a cardiac arrest, our first goal is to get that heartbeat back. And then once that heartbeat comes back, our second goal is stabilizing and supporting that patient with whatever means necessary while we simultaneously try and figure out what was the exact cause. And I'm sure right now that the physicians and providers right now taking care of Bronny are doing just that. I'm hopeful that we'll get more information. And again, the fact that he is out of the ICU this fast, it is nothing but reassuring. And I'm hopeful that he'll be able to be up and back playing his sport like he loves.
We're all wishing him well. Dr. Darien Sutton, we thank you for your time and insight tonight.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.